Hi, I'm Charlotte Kendrick, and I'm going to speak to you briefly about bias in medical teams. Merriam-Webster defines bias as a personal and sometimes unreasoned judgment. Many biases are unconscious, and as facilitators, you will need to help the students understand how these biases can affect the team members and their decision-making, as well as patient safety. While sexual harassment definitely exists, sexism is more common both in medical training and in the workplace. Female physicians are less likely to be introduced as doctor at grand rounds, may be seen as aggressive when they speak up, often feel obligated to endure derogatory comments, particularly when made by a more senior physician, and at times are given duties that are seen as less important. Patients may think that the female physician is not a doctor, but another healthcare professional, and at times request another doctor when they do realize that she is their physician. All of these are exacerbated when the physician is a female of color. Physicians of color or other cultures often feel the need to establish their credibility, particularly when in a room of white male doctors. Their colleagues may make negative assumptions about their intelligence and abilities, and they as well, whether male or female, often feel they cannot respond to derogatory comments nor have any recourse when a patient requests another doctor simply based on their race or culture. Vertical hierarchy is endemic in hospital-based medicine and partly responsible for the pervasive culture of not speaking up. In horizontal hierarchy, consultants from different specialties at times fail to acknowledge each other's role and skill sets. Both can jeopardize patient safety. Sometimes, even when a doctor has misgivings about another doctor's treatment of a patient, they often still feel unable or reluctant to comment, even when a patient's safety might be threatened. It is often easier to swallow their discomfort rather than challenge another physician's viewpoint. Overall, we need to remember that when under pressure or when there is uncertainty, unconscious bias is more likely to play into decision making, as the brain simply does not have the processing capacity to check our objectivity. At times, doctors don't report issues of bias and discrimination when they see them, and leaders often do not know what to do when it is reported. More education is needed regarding bias and discrimination and how both can interfere with decision-making and patient safety. Be aware that gender and cultural biases, as well as the hierarchy in medicine, affects all healthcare professionals, not just physicians. In the end, it is important to speak up for the safety and well-being of the patients and the ability of all healthcare professionals to do their jobs well. For your convenience, a listing of references is here on the last slide. Thank you.